In other news, it's been 2 years since COVID-19 hit our shores and the country went on lockdown. The virus wreaked havoc on so many communities. When the pandemic was at its peak, health facilities were under immense pressure and the government put stringent measures in place to stop the spread of the virus. Eastern Cape, that province, is one of the provinces that was hardest hit. Let me take you to eNCA senior reporter Aviwe Mtila, who joins us now as he reflects on the challenges faced during the peak of the virus. So, Aviwe, tell us more about the family whose story you've been covering that lost a number of relatives. My understanding is that they remain quite traumatized, as do many families that have lost loved ones due to COVID-19.
Certainly so, Bratulas, even suggesting that all these families, if there was a budget big enough to accommodate every family that lost their members through COVID-19, that they should be at least taken for counseling. They still traumatized, scars still fresh, even though it is almost 2 years since then. In fact, they suggest that it's something that they'll have to live with for the rest of their life. Of course, that is the Nzondo family of a retired champion boxer, Lawrence Nzondo, in fact, who passed away at the age of 80 at the peak of COVID-19, because of COVID-19. In fact, the family lost 4 family members, senior members of the family at the time. And of course, they had to adapt to the new normal. You understand, things had to be done now differently, especially for the African families who traditionally would have those night vigils and, in fact, have the assistance of the neighbors and every other aspects of the community, church, your neighbors coming through and to help with the bereavement. They say that all of that had to change. In fact, they couldn't send off their father in the church that they wanted to. They had to now adjust to those minimal numbers that were stipulated by the regulations. They had to now not even attend. You'd understand that some of them came from Cape Town, couldn't come because of those COVID-19 regulations. And what's painful is seeing their father wrapped up in the plastic, the casket coming out in the casket. They had to watch from a distance. They couldn't do things traditionally where they could say their final farewells and see the body for the last time. So that still leaves a scar in the family. And as I spoke to Vuyokazi Nzunzo, the daughter of the late Lawrence Nzunzo, let's take a listen to that.
They come on that day of the funeral. When they come home, you know, in our culture, umuntu omdala is supposed to come in the house. It's his house for the last time, and then we take him out to church. He couldn't come in. We were there in the by the road in front of the house. When the hearse opened the car door, the casket was covered with plastic. Imagine how that feels to see your father as if he was nothing. That's how we took it, as if he was nothing. His coffin was covered with plastic like that. He can't come to his house. That's how cruel COVID-19 is. You know, you can't do the process the way you're supposed to do it. And it's emotionally draining. I cannot lie. It's so emotionally draining and it's so hurtful.
And of course, part of what happened with the onset of the pandemic and its manifestation domestically, Aviwe, is that we got to scrutinize our health system throughout the country, including provinces such as the Eastern Cape itself. And there was a lot of focus on issues such as the hospitals, the state of the hospitals, healthcare workers. And I believe, if I recall correctly, there was a point where we were seeing healthcare workers picketing at some of the hospitals. So what's the assessment among the people who were at the forefront of how the Eastern Cape coped with the peak of COVID-19?
Certainly the spotlight was on the Eastern Cape and the soaring numbers. You remember even pre-COVID-19 how the infrastructure of the health systems here were already ailing. So having the burden of the Eastern Cape, the spotlight then shifted. And of course, assisted by the corruption of the PPE corruption, the nurses that were picketing over their various issues. So the spotlight largely was on the Eastern Cape. But as months went on, we saw the change in the Eastern Cape, if we're to be honest, and we saw how then the numbers dwindled from the Eastern Cape. We saw health officials, even the then Health Minister Aviwe Mtila, coming here time and again, would crisscross the various hospitals, and we'd see the improvement in the Eastern Cape, even though it was heavily burdened by the burden of COVID-19. So a lot of that, if you are to have an honest reflection, was attributed to the work that was done by the then Health MEC Sindisiwa Gomba, who doesn't understand, I beg your pardon, why, in fact, she was fired. We do understand, of course, there was that controversial scooters tender, which she says there wasn't even money given for that. She was fired at the beginning of 2021, and she still is seeking answers as to exactly why she was fired, as we had an exclusive interview visiting her house just a bit earlier on. Let's take a listen to the former Health MEC in the province, Sindisiwa Gomba.
After should I put it as my dismissal of my movement from health, the whole Mandela issue went back to court. And it then became the issue that was said it's being used for a step aside, yet I had already been removed. So your guess is as good as mine to actually say exactly why and what was the issue. Maybe it's step aside. However, one starts to ask questions as to, is step aside, who's really for step aside and who's really not for step aside. But that's a debate for another day, because I'm still in court, and in April I'm sure the truth will come out, and after the case is over, then one is free to talk and reflect on the issues.
All right, let's leave it there. So much to reflect on. Just one of the 9 provinces, just how it coped with the peak of COVID-19 as the situation unfolded, and putting to the test the state of the country's health system that, as Aviwe says, that needed attention even before COVID-19.